Hello everyone, today we're going to discuss the several factors affecting the final result after a penile inversion vaginoplasty or any other vaginoplasty. There are several factors that actually influence the final aesthetic outcome. One of the main factors is the penile length. Longer penises provide more tissue for constructing the new vagina and potentially can result in a more aesthetically pleasing outcome. The other important factor that is not discussed very often is actually the presence of circumcision and what level the circumcision scar is. The location and prominence of the circumcision scar can impact the appearance of the new vagina, especially when we're designing the labia minora. If we look at the scar, the lower the scar is in the shaft, the more likely it is for the patient to have a longer labia minora by using the tissue that is available. So it's not only about the presence of tissue, it's actually where the scar is located, as the blood supply generally does not travel or pass the scar. The third important factor is the stretchability of the tissue. The elasticity of the penile and scrotal skin affects the surgeon's ability to create a natural looking vagina and labia. Another important factor is shown in the pictures here in the black marks is the perineal length. This is the distance between the base of the shaft and the anus. This essentially is the distance that the penile skin has to stretch to then go inside into the new vagina. The position of the new vagina and the overall aesthetic balance of the genital area can be affected. The distance can be longer in patients with higher weights or taller patients. The fifth more important factor is the size of the patient. The body size and the proportion of the individual can influence how the new vagina integrates with the surrounding anatomy. This can affect the overall aesthetic outcome. In general, patients who are thinner tend to have less tissue or fat around the testicular area. This can mean that the prominence of the labia majora can be affected. So it is important to advise patients and understand how these factors affect the final aesthetic outcome. There's great variability, and this variability has to do with the penile length, the circumcision scar, the tissue stretchability, the perineal length, and the patient size. So surgeons may face challenges in replicating an identical aesthetic outcomes in penile inversion vaginoplasty or robotic-assisted vaginoplasties. Acknowledging this and discussing with your surgeon your final aesthetic goals will be very important in deciding what to do and what to expect after vaginoplasty. I hope this helps. Bye.